Hello, everyone. My name is Kelly Sharda, RN BSN student at Indiana State University. Today we will be discussing postpartum depression. Approximately 10 to 20% of women experience depression after having a baby. New mothers coming home after having a baby can develop postpartum depression. Understanding what postpartum depression is, risk factors, and treatments is essential to the overall health of new mothers and their families. Our learning objectives today are: name 2 symptoms of postpartum depression, determine one difference between baby blues and postpartum depression, name 3 risk factors for postpartum depression, and identify treatments for postpartum depression. PAR. So who is at risk? Our population at risk are women who have recently had a baby. At this point, you can pause the presentation and complete the pretest in the link provided. This will test your knowledge to see what you already know about postpartum depression. So what is postpartum depression? Postpartum depression is a mental condition that occurs after childbirth and lasts longer than 2 weeks. Postpartum depression can cause behavioral changes and physical changes. Feelings of hopelessness, sadness, and emptiness that affect daily living are symptoms of postpartum depression. Postpartum depression is caused by hormonal changes after giving birth. So how can you determine if you have the baby blues or postpartum depression? In this slide, we have a list of items that will help you determine if you have feelings of baby blues or if it could be something more serious as postpartum depression. Baby blues includes feelings of being overwhelmed, unhappy, or worrying. However, symptoms usually resolve within 2 weeks of giving birth. Postpartum depression has similar feelings such as guilt, sadness, worthlessness, emptiness, a loss of interest, fatigue, and symptoms usually last longer than 2 weeks after giving birth. Risk factors for postpartum depression. Here are a list of risk factors that would put someone at a higher risk for developing postpartum depression. Personal or family history of depression or bipolar disorder, having little or no support, experiencing depression before delivery during your pregnancy, having problems with pregnancy, experiencing financial or relationship problems, alcoholism or substance abuse, being younger than 20 years old, delivering a special needs baby, having difficulty breastfeeding, and experiencing an unwanted pregnancy. Screening. A 2017 study was conducted in which postpartum mothers were screened for postpartum depression at regular checkups. Screenings were conducted using a standardized screening tool and evaluated at 6 weeks postpartum visits and 2 and 4 month well baby visits. Of the 5,000 participants, 8.1% were diagnosed with postpartum depression. It is important to screen mothers for postpartum depression. There is treatment for postpartum depression. Treatments for postpartum depression include therapy. If you are having symptoms of postpartum depression, you can talk with a psychiatrist and learn ways to cope with postpartum depression, tools that you can use to try to change your way of thinking. You can also set goals and try to create a positive outlook. Medications. There are many medications, antidepressants, that can be used for postpartum depression. Some are even safe for breastfeeding mothers. Talk to your doctor and see which medication may be right for you. In extreme cases of postpartum depression, ECT therapy may be used. This therapy uses small electrical currents to treat most of the severe forms of postpartum depression. So let's get a game plan. According to a 2016 study of postpartum mothers with mental health struggles, most were concerned with the follow-up after discharge. So what should you do? Call your doctor or midwife if you suspect that you have postpartum depression. Also, ask what community resources are available for postpartum depression. And importantly, surround yourself with people who will help and support you. You are not alone. If you are feeling that you have symptoms of postpartum depression that last longer than 2 weeks, call and make an appointment with your doctor or midwife. Understand that there are treatments for postpartum depression. For more information, please visit these websites. There is helpful information, tools, and resources that you can use to help yourself if you feel like you have postpartum depression. Post-test. You are now finished with this presentation. You can click on the link provided and take a post-test to test your knowledge to see what you have learned about postpartum depression. You can use these resources if you know or have a loved one who may be suffering or suspected of suffering from postpartum depression. Here are a list of references that I used to make this presentation. Thank you, and this concludes the presentation.